If you're using a cane, which hand are you supposed to put it in? It depends. By the end of this video, you're going to know which hand to put it in. I'm Dr. Sean, your PT guy, and our videos help you learn how to move better and stay independent so you can enjoy your life. Let's get started. Disclaimer! When you're trying to figure out which hand to put the cane in, you have to first ask yourself the question, am I using the cane for balance, or am I using the cane to reduce some pain in my knee or my hip or somewhere else? If you're using the cane for balance, that's going to be different if you're using the cane to reduce some pain in one of your legs. Let's go over the balance first. If you're using the cane just for balance sake, then just put the cane in your dominant hand. If you're a lefty, put it in your left hand. If you're a righty, put it in the right hand. Or if you have arthritis in your right hand, but you're dominant in your right hand, then it's fine to use your left hand. It's just trying to get an extra point, an extra tip on the ground to increase your base of support and increase your balance. The cane is helpful for that because when you put the cane down on the ground, you're adding another point of contact. So I've got my one foot, my other foot, and now my cane. So that's 3 points of contact that's going to increase my balance and help me prevent a fall. So it really doesn't matter which hand you put it in unless you have pain in your wrist or in your hand from arthritis. Maybe you type a lot. It doesn't matter. Just make sure that you're using, if you can, for balance, your dominant hand. Now, when you are using the cane in your dominant hand or in the other hand, which we're going to get into in a moment, when you're using the cane, just one little thing you need to know. This happens often. When you're using the cane, don't put it too much in front of you because when you go to take your step, you can actually clip your foot. So I like to tell people, hold it on the side a little bit, but even then, cock your wrist a little bit out that way, and then that's going to make the shaft of the cane be a lot farther away from your foot when you're walking, thus improving your balance and reducing your risk of falling. So if you're looking for improving your balance only and you're not worried about any pain or anything like that in your knee or your hip or anything, then just put it in your dominant hand. I'm a right-handed guy, so we're going to put it in right hand. And I'm just going to start walking on. Okay? Now, what if you have pain in one of your legs? It gets a little bit different there. Now, what if you're using the cane to reduce pain? Let's say your hip hurts. Maybe you've got some arthritis in there. Maybe you've got a little bit of a labral issue going on. Your hip just hurts. Mine hurts. Look at this thing. It is swollen and red. It's just coming out. Okay, so let's say I have pain in my hip or in my knee or maybe in my great toe, my big toe. Maybe I have gout. Doesn't matter. If you've got pain on one side of the body, on your leg, you're actually going to put the cane not in your dominant hand, but the left, the opposite hand. Okay, the opposite hand. So even though I'm a right hand person, I'm right hand dominant, but if I've got pain, I'm actually going to put the cane in the opposite hand for those reasons. And when I go and I'm going to start walking, I'm going to put the cane out and then my hurt leg goes next. And what that's going to do is it's allowing me to put that weight through, and that's taking a lot of that compressive weight off of that hip and weight off of the knee. Boy, that actually feels really nice if you have that. It's taking about 15, 20, sometimes 25% of your weight off of that hurt leg. So what you're going to do, cane, hurt leg, okay? And then you step through with the left leg. I have a video on how to do the cane, walking with the cane the right way, which you can find on my channel as well. But for this video, which cane are you supposed to put it in? Which hand are you supposed to put it in? You're supposed to put it in the opposite hand that you have pain. So which hand do you put the cane in? It depends on the situation. If it's just a balance thing, put it in your dominant hand. If you have arthritis in one hand, put it in the other hand. If it's just for balance, you just need that little touch of contact to prevent a fall. Or if you need to reduce your pain so you don't end up having a fall in one of your legs, put it in the opposite leg. If my left leg's hurt, it's going to go in the right hand. If my right leg's hurt, it's going to go in the left hand. Hopefully that will reduce your pain and prevent a fall. Speaking of falls, if you want more tips and training on how I teach people to prevent falls, you can find that in the link in the description below. And if you want more videos just like this one to help you learn how to move better and stay independent to enjoy your life, click the subscribe button down below and we'll see you in the next video.